The Gauteng Department of Health denies owing the city of Johannesburg 240 million rand for a water bill, saying this was a historic dispute. The department says its account with the municipality is up to date. Masibolekwe Ndima is the Gauteng Department of Health Acting Chief Financial Officer. Thank you for making time for us, Masibolekwe. Do you owe the city of Johannesburg 240 million rand? And where are they getting this amount from, if, as the department, you're saying that's not the case?
Maybe let me start. Good afternoon with your viewers. All the years. But what has happened recently, and I think a year before, the city says, look, we've made a mistake on two institutions, which is Charlotte Matlake and Sizwe, to say we've been billing you, but we want to backdate the water for 3 years, the sanitation for 7 years. And our argument was that it's fine. But if you do that, because now it becomes an anomaly, can you, so that we understand, even from the meter reading, where is these charges are coming from? The city never came back to us. And we're saying, look, we are willing to pay you. We will pay you, but convince us to say, these charges that you are now adding, where are they coming from?
And how long has this historic dispute been underway? When did it start, and how is it that it's still not resolved to this date?
It started a couple of years ago. I won't be precise about the date, but I think there is one that around 2019. There's also another one that is cropping up now from City Power. And we are saying that, colleagues, if you've been doing this incorrect billing to us and you want to backdate it, let's see what is the cause of this. And so that, because now we are disputing it, because we've been paying you every month. And now these things are coming out and say, look, you actually owe us more than what you've been paying.
But did you guys not know of this debt, what is due to the city from you guys? In other words, when they're sending you statements and, as you say, you pay for the services, is it not reflected anywhere in documentation that, hi man, there's this amount of money that the city says we owe them and we need to start conversations with them about where this amount comes from?
Say, for example, you need to pay 600,000, you need to pay 600,000. But along the way, the city came and say, hey, you actually owe us more than what you pay. We've picked up an error on our side. Can we backdate? We need to backdate it. And all we've been saying is that it's fine, the city, but show us where is this 240 million is coming from. They have not broken it down for us. We've got a pool of engineers in our infrastructure department. They are willing to go and actually look at the as I say, this is where this 240 million is coming from. We are willing to say, look, let's then, because we didn't plan for this, let's get into a payment arrangement so that we can pay you. But so far, there is nothing.
Yeah. What update do you have from the hospital management with regards to their talks with the city?
The update that I got, actually we had a meeting with some of the city officials on the 23rd. The hospital management is also saying that, look, we need a certain code of a certain meter. So we also want to pay, but before we pay, the city must actually convince us and show us where is these additional charges are coming from. So the hospital management is also the importance of making sure that we pay the municipalities on time and so forth, because it has an effect on service delivery. But I don't know if you also know, Clement, when it comes to the city billing, it's a challenge, especially if people just rock up and say, we want to charge you for 7 years on sanitation, 3 years on water. You would question that because it's not on your normal statement.
How are you going to resolve this then? What's the next step? Because the city is saying, listen, if you're not paying up, we are going to start terminating some services.
So the plan is, I've requested the contact of the group CFO, and I've asked my team on the meeting that we're going to have with City Power, because City Power as well came to us and say, hey, by the way, some of these hospitals were that look, let's actually look into this on Monday. So we have organized a meeting. We hope the city will come and they will be able to actually allow us or even them to actually look at these additional charges. Because it's more of I don't know how can I put it in a professional term, Clement, whereby you suddenly you are told you are owing this and then we will cut you. While you've been paying the account each and every month, and you are told that, look, we'll backdate this one for 7 years, this one for 3 years. And we say we are not even fighting that, but show us. Don't just show us or send us an age analysis that shows 240 million.
Yeah.
Come, you left this thing for 3 years, the other one for 7 years, and you're only rocking up with this now. So we want to meet the city on Monday on urgent basis so that we can find an amicable solution to this thing. Because if they cut, the results will be okay. So we can't just cut the electricity or water or whatever they need to do. So we need to actually...
So if they decide, that they are terminating the services, which areas are going to be affected?
The Charlotte will be affected, definitely will be affected. We've got high care units there, so it will be affected. The Sizwe also will be affected. So, but then we can't really be in a position to say, this is how we play. And then you don't even... And this has been a norm in our department. And since we came in, we've stopped a number of people that are providing us services, where they just come and say the department must pay. And then when we look at it, actually there is no reasonable assurance to say you are actually owing this. So it has been a norm. And that's why every statement that we get, we scrutinize. And after scrutinizing, if there are any things that are additional, we'll always call you and say, please explain. And the city has not done that to us.
Let's hope that this is going to be resolved. Thank you so much for making time for us. Masibolekwe Ndima is the Acting Chief Financial Officer at the Department of Health.